Good afternoon to Dr. Rohit Shetty and entire NNT for this fantastic conference. Probably we have overlap of our talk. I'll skip through the few slides how the flap misbehave. With the era of lenticule and the femtolasic, we still have to use our traditional MK and we do get certain complication. Probably we are not using our microkeratum so frequently now when we are using so much of lenticule and femtolasic. But then flap related complications are still rare, but they have a very high impact. I'll just go with the video. What will happen when you have a complication? Stay calm, take deep breath, do not discard the flap. Identify epithelial versus stromal side and maintain orientation throughout the preoperative marking. That's the most critical in the previous video because if you don't have a preoperative good marking, so in spite of doing so many surgeries, the marking is most critical. Don't forget ever to do the marking. As previous speaker has already said, first see your bed. If bed is clear, you can go for the excimer laser. Irrigate the stromal bed properly, align the flap and then go ahead. Whenever the microkeratum is passing, keep your eye, a very keen eye on how the flap is moving and the flap is remaining in the microkeratum, it is already passed through. So just go through this video. Sound. So you always examine microkeratum once you complete the class. Sometime because in the next video probably the flap is still remaining. Here you can see the flap is still over there. It is a very minimal hinge but it is already gone. Keep the flap as it is. Since the bed is good, you can go and complete your excimer laser. I always mark on the two sides, 2 up and 2 down. So it is always a 4 marking, a standard pattern for my LASIK surgery. Flap is well aligned and the surgery post result was really good. The another patient with a similar, the 2 marking as a pre-operative to start with for every case what I do. It was a routine case, the other eye, the first eye went very well and then second eye. Oops, the flap is still in the microkeratum. If you miss this tab and you are just searching for the flap over there, so here, the flap was already there remaining in the microkeratum. And then we had actually the bed, even though bed was regular, we kept that flap separately, clean. Since the bed was regular, we had gone ahead with the excimer, completed our excimer laser part and then realigned the flap. What is really help is a marking. So if you miss your marking, it's really a nightmare to find out the epithelial and stromal side, put the flap again. Over and above we do, not only we put a bandage contact lens, we put a 2 different size of bandage contact lens because just for our additional security. We have never put a sutures in any of these cases. In the last case, which was an incomplete flap, there was a superficial pass with a loss of suction. So there was hardly very thin flap which was very made. In this case, we had to convert to the PRK. So you can just have a look. Very superficial, very hardly any flap. So remove the epithelium manually. It was just an epithelial cut. So we have removed with the hockey stick knife with a Mirosol sponge. The bed was regular, so we went ahead with to do a PRK over here. So key to home message is recognize early all these complications, don't get panic, do not force completion. Your patient safety is more important than completion of the surgery. So complication don't define the surgeon, but the good management does. Thank you very much. Thank you for kind attention.